Good morning.
Hi.
Welcome to the next edition of Total Health Talks. I am Dr. John Stiteler here at Total Health Guidance, and today's topic is going to be on autoimmune disorders. So we just want to introduce our panel here. Again, I'm Dr. John. I'm a naturopathic doctor focused on psychology, and with me is...
My name's Covyn. I'm an acupuncture physician. I work with herbal medicine, acupuncture, and nutrition.
And I'm Tony. I'm the massage therapist here at Total Health Guidance, and I'll be looking down at the computer to answer any questions that you might have during the conversation, so welcome.
Awesome. So we kind of wanted to start off with what autoimmune disease is, because there's a lot of information out there, and it can be kind of confusing if you maybe were just diagnosed or someone you love was recently diagnosed, to kind of get a baseline of information. And so just kind of broadly speaking, autoimmune disease is any disease that's categorized as your immune system attacking its own tissues. Okay, so that's pretty just general autoimmunity. But for different specific autoimmune diseases, they attack different tissues. For example, rheumatoid arthritis, they attack the joints. So in that disease, you'll see a lot of joint pain and maybe redness around the joints with some swelling. But for psoriasis, it's attacking the skin cells, so it's making your body produce skin in excess, so you get that flaky skin. For multiple sclerosis, some people, you might just hear it as MS, this is where the body's attacking the myelin sheath, and so that's the covering around your nerves. Now, the tricky thing about MS is it doesn't attack specific nerves. So everyone who has MS might experience it differently, because if it's attacking maybe a nerve in your neck, you're going to have different numbness and paralysis over here. Whereas if it's attacking a nerve in a different place, you might have numbness or lack of feeling or tingling or something like that elsewhere in your body. Okay. Another one is myasthenia gravis, and that's kind of similar to MS, except it attacks the muscle tissue. So you'll still get that numbness and tingling and possibly a lack of function of the muscle, but it'll look a little different than MS. So another really popular one is lupus, and lupus attacks the joints, but it also focuses on certain specific organs. So depending on how you're presenting or how your body is manifesting the lupus, you might have different symptoms from person to person. That's something kind of interesting about all these autoimmune diseases, is that it's very specific for each person, because your body's attacking tissue, but your whole body's made up of different types of tissues. So, you know, you could have 3 people with lupus and all be experiencing, some things might be the same, but they also might be all different. Which makes autoimmune diseases in general just kind of difficult to work with as a doctor, but also difficult for the person experiencing it, because their story might be very different than other people's stories. So what we know about autoimmune diseases is it starts with a trigger or something that causes a catalyst for your body to start creating antibodies. And for whatever reason, that those antibodies start attacking different tissues in the body. Sometimes it might be because of an infection that caused the body to think that this tissue was actually the infection, or it might be, you know, due to some other risk factors. So there's theories for environmental risk factors like toxic chemicals, chronic cigarette smoking, or secondhand smoking. There's also infections like the Epstein-Barr virus that's specifically seen commonalities with MS and rheumatoid arthritis. But there's dietary factors as well, the microbiome, and how our body actually creates an immune system in the first place. But there's another one that's talked a lot about, and that's genetics. And I kind of want to park out there, because a lot of people can kind of see the genetic explanation as a death sentence. And by that I mean, well, my mom had it, therefore I'm going to have it. Therefore, if I have children, or maybe already I have had children, they're going to have it. And that's, while genetics may play a part, it's not by any means a death sentence in that. I know there's a lot of different studies going on about epigenetics and things like that.
Yeah. along those lines, with genetics, when you hear about genetics, we got billions of cells in our body, right, that make up, our DNA. And with that DNA, the genetics, we have about over 20,000 different genes that make up our genetic code. And the whole study, what Covyn just mentioned, of epigenetics, this is a relatively speaking new facet of medical science in the last decade or so. It's really taken off. And that's looking at how we can impact our genetic code. It used to just be thought that, okay, our genes are our genes, and whatever genetic, if you inherited breast cancer genes or obesity genes or alcoholism genes, or in this case autoimmune genes, you're destined to get those diseases. Well, this latest studies around epigenetics is showing that, wow, we have a lot of control over what we do. It's sort of nature versus nurture. The nature is what we inherit. We inherit a genetic code. But the nature, what we do with that genetics, we can change it. And there's an analogy that comes from a book, Epigenetics Revolution, that I just thought it's a great way of explaining it. Picture your life as your lifespan as like a long movie, and over the course of your lifespan is this movie, and your cells are all the different actors and actresses and all the different people playing a part, in your life. That's all your cells. Well, your genetics, that's like the script, the basic script of your life. What's going to happen and things like that over your life. Well, epigenetics is like the director of the script, and the director has control over whether to delete that scene or whether to tweak and adjust, to spin the outcome of. Even though the script is written a certain way, the director has a lot of control over what this is going to look like. And that's the epigenetics. So you have a lot of control. For example, you could have the same script, and if it's being directed by Steven Spielberg, it's going to look a lot different than if it was being directed by Woody Allen.
Right.
So we have a lot of control from the mind perspective, the body perspective, and the spirit perspective. So how we think, epigenetics, in terms of what we think, our perspective on life, what we eat, how much we sleep, whether we exercise, even our spiritual outlook on life. All those things from a mind, body, spirit really play into the role of directing this DNA script that we inherited.
Yeah, I love that because it gives a more hopeful outlook, not only on genetic diseases, but even just any disease in general. The fact that we can kind of control and bring our body to a different stage of health.
Yeah, they're like on and off switches. So we have all these genes, and it's like a big circuit board that has this on or off switch, and based on our outlook and our diet and all these things from a mind, body, spirit perspective, we can turn these things on or off. And so it really is empowering.
Yes, indeed. So in relation to autoimmune diseases and those on and off switches, so from here, for the rest of the discussion, we're going to kind of focus on people who have already been diagnosed. So some of those switches were flipped on, and now how do we work towards a better, healthier state? And so I kind of want to introduce the discussion of traditional Chinese medicine, because we view autoimmune disease quite interestingly, and it might not make a little sense. I'm going to throw some terms out there that might not make sense, but I'm going to explain them. So we define diseases very differently. For example, autoimmune disease would fall under 3 different categories, which in Chinese medicine, it really goes to show how complex autoimmune diseases are to be in 3 different categories. So the first one would be a fire disease, which again, I know sounds a little odd, but we can relate that to inflammation or heat or something like that. The second one would be wind, okay, again, I know a little odd, but wind disorders are usually, just like wind in general, ever-changing. And I think that's a really great way to explain autoimmune diseases, because if you've ever worked with someone with an autoimmune disease, or if you have an autoimmune disease, day to day,
It's very different.
Yeah, it might be very different. Today this joint hurts, tomorrow this joint is going to hurt, maybe the next day all of my joints are going to hurt. So it's very changing. And then the last one is phlegm, which in phlegm disease. And so to kind of westernize that, we talk about toxicity, okay, a toxic buildup, which again would point towards some of the risk factors for generating an autoimmune disease, which is chemicals or environmental risk factors, something like that. And so when we view it like that, autoimmune diseases within those three different categories, it really helps to shape how we actually start treating and working with someone with an autoimmune disease. So whenever I start working with someone, there's three different aspects of care that we start looking at, okay? So the first is relief care, the second is corrective care, and then maintenance care, okay? Relief care, as you might assume, is just to get the person out of the extreme part of their illness. So if it's a pain disorder, we want to get them out of pain during that relief care, okay? Because the first thing, we're not necessarily focused on the root of the problem unless the root is going to fix the symptom. We just want to get rid of the symptom during the relief phase. Okay, so for people with autoimmune diseases, this would be working on the inflammation immediately, because oftentimes inflammation just causes a lot of pain for people with autoimmune diseases, and it's difficult for them to work on anything else because the pain is so intense. Okay, so then there's corrective care, and within corrective care, that's when we're really starting to start working on the root cause of the problem. Okay, so for autoimmune diseases, it's an immune deficiency. Your immune system is mistakenly trying to correct different things that it's not supposed to be working on. So it's helping to boost the immune system so that it can actually start focusing on what it needs to, instead of suppressing the immune system and just kind of creating further deficiency in your immune system. And then the last one is my favorite. It's maintenance care. And it's my favorite because I don't have to see people very often for maintenance care, because they're doing so well with their lifestyle and some of those on and off switches of the epigenetics that we were talking about. They're doing well with that, so they don't really need someone to come in and help them. But then the maintenance care, it doesn't mean, oh, well, I'm good, I never have to see you again. It's a, hey, I'm going to check in periodically just to kind of de-stress or help with a uplifting treatment. So it just kind of, it's different ways to focus on different things. But those are some of the principles using traditional Chinese medicine's perspective and how I would treat and talk to anyone with an autoimmune disease.
Yeah, very good. Thanks. So we know here at Total Health Guidance, we look at people as integrated, holistic beings. You can't separate your physical and emotional and relational health. They're all connected. So when we look at treatment for anything, and specifically in this case autoimmune disorders, we're looking at it truly from a body, mind, and spirit perspective. So from the body perspective, we're going to do some of the things that Covyn just mentioned, treating it from an acupuncture perspective, but we're also going to look at a diet perspective. With diet and nutrition plays a huge role in autoimmune disorders. Specifically, we're looking at the reduction in inflammation,
right.
the fire component of the disorder. So when it comes to autoimmune disorders in the inflammatory state, we're really looking at a couple key components to either eliminate or reduce and other things to add. So to get to an anti-inflammatory diet, one of the biggest sources of inflammation in our diet is sugar and processed foods. So the reduction of added sugar, and we're not talking necessarily about fruit sugars here, but fruit juice or added sugar, concentrated sugars are going to be very inflammatory, and all kinds of processed foods are naturally inflammatory. Also, animal-based products. So the reality is we eat too much, this just standard American diet, we eat too much animal-based products and not enough plant-based products. We're not saying everybody has to be a vegetarian or a vegan, but if you have an autoimmune disorder, you probably want to significantly reduce or potentially eliminate animal-based products because they're naturally inflammatory. So we're talking about meat and dairy and even eggs and cheese. All those things are going to be naturally inflammatory, so reducing them is going to be important. And then from an oil perspective, we know there's good fats and there's bad fats and there's really bad fats, if you've heard me speak about that before, but specifically we're looking at the trans fats and the added fats, the added oils and stuff into our foods. Fast food, anything with hydrogenated oils is going to be naturally inflammatory. So we're cutting out animal-based products, we're cutting out processed foods, or again, maybe not cutting out, but at least eliminate or reducing them, and added sugars and these trans fats. Now at the same time, we're adding. It's not just a diet. We're not trying to take away and be negative. We want to add, so we want to get more anti-inflammatory foods, which are primarily going to be your fruits and vegetables. So almost all vegetables are naturally anti-inflammatory. Most people don't get enough fruits and vegetables. That's when we might supplement with something like Juice Plus, a concentrated fruit and vegetable concentrate. We want to get as much fruits and vegetables as possible. Also spices. There's a lot of spices that are naturally anti-inflammatory. I think of some of the ones like ginger, cayenne pepper, cloves, garlic, turmeric. They're all naturally anti-inflammatory. So adding some creative spices into your diet can be really helpful at reducing inflammation. So we're looking at it from a body perspective, from a nutrition, from a treatment, but also from the mind perspective. For people that are struggling with an autoimmune disorder, it can lead to depression. Having any kind of chronic pain or chronic health condition really has a toll on our mental health. It's not just a physical issue. So coming in maybe to talk to a therapist, talk to a counselor, and coming up with a self-care plan or ways to deal with the mental distress associated with an autoimmune disorder can be a positive treatment protocol for somebody with this issue. And then even from what we would call spiritual perspective, the grief associated. Whenever you get diagnosed with something like a chronic issue, there's a loss. There's a loss of freedom, the loss of these foods that I enjoyed, the loss of freedom to be able to do these exercises and do these activities that I used to enjoy that I can no longer do. And whenever there's loss, there's grief. And sometimes grief therapy and working through that process and going through the stages of grief to come to the acceptance phase is part of the holistic journey. So I want Tony to talk a little bit more about maybe inflammation specifically and how massage can play a part in the treatment protocol as well.
Great. So as we're talking about some of the autoimmune diseases, I'm just going to focus a little bit about massage and how that can help. What we want to do is make sure always check with your doctor on your status, because as Covyn kind of mentioned earlier, with lupus, people experience different symptoms at different times, and they're more severe depending upon the individual. So when you're getting massage or you're planning on doing massage, you always want to inquire with your doctor to make sure it's okay for your particular individual case. What you want to look for is someone who understands autoimmune and inflammation, and what massage can do for inflammation is help relax the body and kind of turn things off and calm it down. So any type of deep tissue work, aggressive massage work can be counterproductive for someone that's dealing with an autoimmune issue, especially when you're in a flare-up. So what you want to do is have someone who's focusing mainly on sweetest massage, light, long, smooth strokes, nothing really aggressive, trigger point therapy, deep tissue, things like that are probably something to steer clear of. A therapist that has the skill and knowledge can incorporate things to support the need for deep tissue or trigger point therapy with other things like stretching and passive techniques for your body so you can continue to relax. So my idea for autoimmune, the main focus is to help the body just calm down. We do specific aroma touch massage here with essential oils. It is one of the most calming and relaxing massages. The most common effect is people literally fall asleep and snoring sleep. So it's kind of really cool to watch people really shut down. And I think as we're moving through life, these things that are affecting us, as John said, mentally, they can affect us. We're just always on right now. Our phones, our watches, our TV, the radio, everything's always going. You're in restaurants now, and there's hundreds of TVs, it seems like, all around. So it's really important to give your body the rest. When those switches get turned on, it's taxing your internal system. You might not feel it or be aware of it all the time, but it is draining your body energy. The fuel that you use to feed it is being depleted. So you want to focus on the diet, as John mentioned, taking good care of yourself. So just a couple ideas for rheumatoid arthritis. Massage can help decrease the pain and improve range of motion, and also reduce anxiety as well, which is often a result of people dealing with pain. It's anxious about movement, it's anxious about how to sleep, how to lay down, how to walk. It can be really stressful, and if you're not aware that that is an effect that's affecting your mental status, again, it's just going to keep cycling through. So it's really important to be aware of how you're feeling emotionally when you're managing any type of pain or issue or disorder or disease. For multiple sclerosis, again, we can lower the anxiety, it can reduce pain and depression, so just helping to improve balance in the body as well. With fibromyalgia, which is, there's a debate on whether it's an autoimmune issue or not. It's more considered, I think, a neurological issue as well. But the pain and inflammation associated with fibromyalgia is so common, and it actually tricks you because it can be mistaken for lupus and vice versa. So definitely with the diagnosis, make sure that you know what the diagnosis is. But regardless of these different types of issues or autoimmune diseases, the best thing to do when you're focusing on massage as a treatment, and I highly recommend it, no matter who you go to, is to make sure that they're doing relaxing work that isn't adding stress to your body, that they're aware of when you're in a flare-up or where you are in your autoimmune issue. If it's a flare-up, you definitely want to take your time and be calm with your body and really kind of give it time to recuperate. And as Covyn said, I mean, I'm a proponent of acupuncture massage. I've been doing it for years. It really helped me recover my life back. So I highly recommend the combination too. I think it really complements each other in how we do that. So I'll post this a little later, but there is a study at the University of Miami. It's a Touch Institute study that kind of showed how beneficial massage can be to deal with these types of considerations and diseases. So I'll post that later when I have time. But I think that's pretty much it.
There's one more thing I kind of wanted to add, and it kind of touches on everything we've been talking about. With autoimmune diseases, it's easy to fall into the thinking that my body is betraying me, because your body's attacking itself. But that's a really unhealthy way to think about a disease. And I'm sure John can speak into this too, because it causes you to doubt that your body can handle itself. And with this disease, I really caution that belief, because like we talked about earlier with epigenetics, you do have a lot of control over the triggers that are causing flare-ups and over the things that are causing you struggle with your autoimmune disease. And so, like, there's a lot of different tools and resources out there for if you're experiencing difficulties with an autoimmune disease, or maybe someone you love is experiencing these difficulties. I know there's a lot of, we're all passionate about autoimmune diseases. We all love working with people with autoimmune diseases. And I encourage you, if you have an autoimmune disease or you're struggling with something like that, come into the office. Even if it's just for a consultation. Any of us would be willing to sit down with you and talk to you about which direction you need to go. Because that can be difficult too, knowing where do I start? Do I start with the mental? Do I start with the massage? Do I start with physical? Which medication should or shouldn't I be on? There's so many questions. It can seem confusing. And so I definitely point you towards that as well.
Well, as we wrap up here, if you or somebody you know or love has an autoimmune disorder, we want you to think about the different things we've discussed here and start to implement one or two of them. Maybe you're going to reduce the amount of animal products in your diet. Maybe you're going to increase your fruits and vegetables. Maybe you're going to come in for a massage or start an acupuncture treatment. Maybe you're going to do some of the counseling associated with the mental or the spiritual aspect. There's essential oils, there's juice plus, there's lots of different things, natural approaches to treating autoimmune disorders. You can't do it all. You're not going to just revolutionize right from the start. But pick one or two or at the most three things to begin with, and as those things become habits, then begin to implement another one. And again, I just want to echo what Covyn and Tony have said. We were more than happy to do a free consultation. So at any point, if you're watching this online and you want to give us a call here at Total Health Guidance, we'd be happy to sit down with you and give you a big picture of what a natural approach to treating autoimmune disorders looks like. And thank you for joining us. Join us next month, again, the second Saturday of every month for a next edition of Total Health Talks. And we'll look forward to seeing you then.
Yeah, so next month we'll be, again, it's the second Saturday of every month, right at 10 o'clock live. You're also welcome to join us here in the office. We will be talking, our Total Health Talk for April will be on diabetes. And I will be posting a handout online that you can look to keep track of maybe the choice that you make, the one thing or simple things you might want to try to do to help deal with your disease at this moment.
Perfect.
Good.
All right.
Have a great week.